Start again. Good afternoon, New Mexico. It's Governor Lujan Grisham. I'm sorry that we're starting late, but we want to make sure that the information we provide to every New Mexican is as up-to-date and current and relevant as possible. That's our job. The best way we keep everybody safe is to let you know what's going on and what we're doing to keep you safe. And before I tell you about our case status, and about testing, and I've got, of course, our usual experts. There are many more in the state who are unsung heroes, but I have the Secretary of Health, Secretary Kunkel. We have one of our chief infectious disease and epidemiology experts, Dr. Chad Smelser. We also have Dr. David Scrace, who is the Secretary of the Human Services Department, all who are with the countless support of many other health experts and scientific experts in the state, are doing incredible work and are here to make sure that technical questions are answered productively during this press conference. Two, I really want to do shout outs. All right, there are thousands of New Mexicans who, without a public health order, who have stood up in this national and state crisis in ways that, quite frankly, as a proud governor, I certainly expected. But it is important to let every New Mexican know the incredible participation. So let's quickly do that. First responders, police officers, firefighters, the men and women on the front lines of our healthcare systems statewide, government workers at all levels who are shoring up necessary essential services and putting those together in ways that are just, quite frankly, I can't enumerate all of them. They're that expansive. Let's make sure that we are clear that we have two bodies of workers in this state who are not getting enough praise and thanks for what they're doing. All right? That's our child care workers, who in more circumstances than not are some of our least paid workers in the state. And who are they providing services to? The families who are our healthcare workers and our first responders, without which, and at-risk families, if they weren't standing up child care, you wouldn't have access to basic public safety services or a robust healthcare system. Let's also talk about another group of workers who need access to child care, who are on our front lines. Every person working, whether they are stocking shelves or they're the checkout cashier at your local grocery store or convenience store, they are incredible. They've been working extra shifts, overtime, late hours, and not a one of them anywhere in the state, to my knowledge, is failing to show up and make sure that everyday New Mexicans, all our families, have access to medical supplies, hygiene products, and food. One last category, the number of New Mexicans who are volunteering to deliver hundreds of thousands of meals to school children, vulnerable populations, including seniors, fantastic. And because we thought about this, I feel like New Mexico, compared to the country, is in really good shape in the context of making sure that no hungry family as a result or child of school closures is not getting the attention that they need. That's not to say that we can't do better and keep increasing access, but I want to thank every single worker, every single site, every charter school, every public school, every nonprofit, every church, every supplier of foods and services, that without that kind of statewide effort, there is no way in a couple of days we can provide that kind of food support to our families. It's been incredible. So, we also have donors and other volunteers who are identifying resources that can go to our nonprofit and organizations, who then can stand up any number of additional services, whether that's in-home care, transportation, child care, and any related food, anything that keeps people safe and at home during our social distancing is imperative and really appreciated. So for all those New Mexicans who stood up, quite frankly, without the governor or your state asking you to, they just did it. One last thanks, and then I'll go right to the updates. and the next set of announcements. To all of the families and workers who took seriously that this is a public health emergency, that the only way we can stop the spread of this deadly virus, COVID-19, is by preventing human contact. It is that simple. The less human contact we have, the more control we have over your safety and well-being. By and large, New Mexicans have heeded that advice, and your employers have supported you, and you've made conscious decisions about staying home with your family. However, there are still far too many New Mexicans who are continuing to engage in non-social distancing behavior. We're going to talk about that in a minute. So here's where we are today. We've added 5 new COVID-19 positive cases. We are now at a total of 28 cases. We have confirmed COVID-19 in Socorro County, Bernalillo County, Santa Fe County, Taos County. We are continuing to engage in as much testing as possible, and I'm going to talk a little bit about that and make sure that I defer to experts because we are reliant. At the very beginning, no state could test without the federal government. Huge failing in the efforts of the federal government. I'm pretty clear that there's not a single American who's not currently aware of that failure. Federal government now is trying to engage private partners in the way that states have always engaged private partners. That's allowing us to increase our capacity, including standing up drive-through sites so that you're not going into your doctor's office and you're not going in right to a hospital. We don't want that if you're showing symptoms of COVID-19. We'll have some of the docs talk about that. The 28 cases confirmed represent about 1.6% of the 1,720 cases that have been processed in the state of New Mexico so far. An additional 500 tests are being run today. We are working to get supplies and feel confident that the White House is now directly engaged in lifting what has been, in my opinion, an interruption in the orders that we have made for additional supplies, which allow you to collect the sample from an individual and then allow you to put the chemical agents, the enzymes, together with the sample that allow you then to run the tests. We've also interrupted in getting the kind of equipment that allows you, I'm sure you're hearing this around the country, what we refer to as high or higher capacity machines, right? That's critical because the more equipment that we have, so it's not labor intensive. One person in their lab with one test tube, with one sample, trying to do that, we want to use all the technology, experience of the state possible, but that supply chain cannot be interrupted. I feel confident that the White House is clear that when we do our job to test, to do surveillance, to keep you safe, then we're keeping Texas safe, and Colorado safe, and Arizona safe, and Utah safe. And when we do that, we increase the protection and safety of the country. When we do that, we increase the protection and safety of the world. So the more we do, the more we're doing for everyone. All right. I'm going to announce a series now of orders that we are prepared to provide today that will go into effect tomorrow. As I've stated before, basic context here is no social contact, limit it, social distancing, social distancing, social distancing. The more you do, the more control we have over COVID-19. All mass gatherings are prohibited. All restaurants, bars, breweries, eateries, and other food service establishments will be limited to takeout service and home delivery only. We want to support these local businesses. It also helps our grocery stores by delivering food to a number of sites that then make that food available to New Mexicans. Shopping malls, recreational facilities, health clubs, spas, recreational facilities, movie theaters, and flea markets are also directed to close by virtue of an order that will be effective tomorrow. Typical office environments where you're not engaged in essential services should immediately limit operations to the extent feasible. People need to think about that limitation at 10. Frankly, if you can limit it further, what's the message? Social distancing, social distancing. We're practicing that social distancing in this press conference today. All casinos and horse racing facilities and attendant restaurant or bar operations shall also close. Now, this directive does not include tribal casinos, because as governor, I don't have unilateral power to do that. To their credit, our sovereign nations have nearly 100% either closed or in the process of closing their gaming operations. We will continue to work closely with our tribal partners to make sure that we succeed in 100% effort in the state of New Mexico. Hotels, motels, and other places of lodging shall immediately go to 50% of their capacity. One issue related to our hotels and our hospitality industry is that we're going to need healthcare workers and potential other workers to have a place to go that limits their social contact and interaction with their families. So there is a productive reason for that threshold in thinking through the potential for emergency responses and making sure we have the capacity to do that productively. This order will include very specific information about enforcement. And while I started this press conference with thanking New Mexicans, and it is real and sincere, there are still far too many New Mexicans who are coming in to contact with one another. We take this very seriously. My job to protect the state and the health and safety of well-being of not just every New Mexican, but every first responder. And in this context, that includes direct care workers, child care, healthcare workers, men and women making sure we can keep food in our kitchens. That we have to be clear, we will enforce these. All public and private folks we have control over in an emergency context will comply with this order. One last thing in the order that is critical. We are also using the power of these emergency public health orders to make sure that every New Mexican has access to basic medical over-the-counter supplies and hygiene products. Unfortunately, as people have been really worried, and I can appreciate that worry, any emergency is difficult. This one is too. But panic doesn't help us manage this in a way that enhances our ability to protect you. So as people are rushing to grocery stores and buying large quantities of necessary items and limit the availability of those, that becomes hugely problematic. And so this order will assure that those supplies are available by limiting the purchase or hoarding of those necessary supplies. The federal government and your state leaders, including me, have directly reached out to the supply chains of necessary hygiene, over-the-counter medical, and food supplies. I have no indication that we can't garner access to those and that they're not routinely coming. What we have to do a better job at is taking all of that off the shelves and not allowing everyone to have the kind of productive, orderly, equal access to food and supplies. One last shout out. I want to shout out to the grocery stores, and there are several, and we will put lists on our website. You can see our phone numbers on our website. To the left and right of me, we want people to continue calling. It's helping us. Many grocery stores and grocery store chains are opening an hour early to make sure that vulnerable populations and seniors, disabled adults, have access to that shopping unhindered and supported, so that we make sure that they're getting the supplies and food that they need as they practice social distancing. I want to applaud the leadership of those marketplaces and grocery stores. And again, many spas, many restaurants, many gyms, and many movie theaters proactively moved to closing. What that should say to every New Mexican is we are clearly in this together. We are clear that we need to limit our contact, and the more that we do productively, the safer we are. And what is my ultimate goal? Keep you safe, make sure that you don't get this virus, and to make sure that we don't see a surge because we didn't manage contact so that we overwhelm our hospitals and healthcare providers. I'm going to say that one more time. My ultimate goal is to always keep every New Mexican safe. I will do everything that gets me to that place. That's my job. And it's painful. It has huge economic consequences. It has huge personal economic consequences. And we must take care of those, which is why we've opened up unemployment insurance and payments. It's why that we're looking for ways to provide health care for any healthcare worker, uninsured, or child care worker, uninsured, that has COVID-19 or gets COVID-19. They'll be immediately placed to the New Mexico high-risk pool. We'll pay their premiums for the duration of their health care and treatment, and their families. We all have to do our part to understand that these decisions are hard and painful and difficult. But we will get through it. And the more we do on the front end, the sooner we get through it, the safer you are, the better we'll be, and the more ready we'll be to stand up our small businesses and our economy again. So I do want, before we take questions, I want to ask Dr. Smelser to talk about one case in particular, because so far all of our cases have been travel related. We said that when we thought there is an issue that we needed to discuss with New Mexicans, we would make sure that you had that information as soon as we have that information, so folks can get a sense about where we are in battling COVID-19. Dr. Smelser? I'm going to get off this. You might just have to be really tall, sir.
That's fine. Thank you, Governor. Thank you, New Mexicans, for allowing me to speak to you today, this afternoon. I'm Dr. Chad Smelser. I'm the Deputy State Epidemiologist, New Mexico Department of Health. I do want to just make a quick clarification that the counties that are affected are Bernalillo, Santa Fe County, Sandoval County, Socorro County, and Taos County. Of the 5 cases that we're reporting to you today, we do have 2 cases that are contacts to a confirmed COVID case, 2 cases that are travel related, but 1 case that we have known exposure. That means to us that there was spread in our community. That case is located in Bernalillo County, which is also to be expected. That's our highest number of cases and our largest population. And typically, that would mean when you have community spread that you need to institute social distancing and community mitigation techniques. Thankfully, under the strong leadership of the governor and the secretaries of health as well as health and human services, we've already started those social distancing techniques and community mitigation initiatives. We are also counting on everybody in this state, from the general public to schools to employers to our healthcare system, to continue those strong efforts in order to minimize our person-to-person interactions. That is what's going to help us slow this, the spread in the state of New Mexico and help us combat this pandemic. With that, I stand for questions.
All right, thank you. Questions?
How are you going to enforce, I know you were talking about restaurants with takeout only, hotels, 50% capacity. How are you going to enforce that?
So the state has, through its powers for these emergency orders, has the power to fine, so there can be civil and potentially criminal penalties and licensure issues related to folks who don't comply. Now, while I was clear, and I appreciate the question, that we will hold folks accountable, I want people to understand that we know this is incredibly painful to those businesses. That pain is felt everywhere, and it's really something I take into a consideration every time we make an order that I know impacts the viability of these businesses. Painful. But I have to protect the state and the well-being of our healthcare workers and our police officers. And that means if these civil penalties must go out, they will. I want to thank everyone who's not required us to do that, but I do want people to be clear that that's the job we must do to make sure that this is fairly administered statewide, and that the goal of protecting New Mexicans and limiting spread, that I will do everything in my power to do that. Yes?
Can you tell us a little bit more about the case with the unknown exposure, like the age of the person or anything like that?
I believe we can, and to make sure I get that right, why don't we have Dr. Smelser come up here and do that? And we appreciate those questions, and we update. I'm going to make sure that people are going to the website, that are getting that information, so they're clear that we know as quickly as possible what's going on in the state, and that we're assessing and analyzing that data to keep you safe. Doctor?
Certainly. Thank you for that question. That patient is, as I mentioned before, a Bernalillo County resident. It's a female, or is a female, in her 40s. And I didn't mention this before, but all 5 of those new cases we announced today are recovering at home.
Thank you.
Sure.
Other questions? Yes?
I have a question about testing. It seems like more needs to be done to add to the testing capability. Loveless had to temporarily shut its drive-in facility, and also Presbyterian said yesterday that they can do 1,000 evaluations a day, but Tricor can only do 300 tests a day, so there seems to be a bit of a bottleneck. So my question is two-part. What is the state doing to help address that? And 2, we were told yesterday that the state's planning to set up its own testing sites. If you could tell us more about where that's going to be and if that's aimed at addressing this issue.
So yes and yes. And for folks who are reviewing, let's make sure what you asked me, that are we doing more to expand our testing capacity? The answer is yes. And you mentioned, and I appreciate that there's been what could appear to the public that somehow Loveless started and then they stopped, and that press has some limitations. So I'm going to do, if you don't mind, talk about a little bit of the limitations about standing up test sites. So one, something that you might be seeing in the media, and you might be reading about, is something called PPE, personal protective equipment. So these are masks that are specifically fitted, N95s, for healthcare workers. These are surgical masks for individuals who might be sick. These are gowns and gloves. This equipment typically gets to the state. Hospitals order it. We order it for public health. There's a national stockpile. So basically, that's where this equipment comes from. And this country and any number of countries manufacture that. In this global crisis, federal government, and frankly I agree with their decision, I disagree that they have the capacity to execute it, and I disagree that they're effectively supporting states like ours who have a ton of resources to really help the country get this right? So you can't have these sites up and running if whatever they gave to that local site, like Loveless, if they run out of that equipment. The state pre-ordered proactively in preparation for this potential public health crisis that kind of equipment. We only got 25% of our allocation from the federal government. We're very unhappy about this. Every state is unhappy about this. Federal government's working to get us greater allocations. We're not waiting. We have also ordered those kinds of that equipment, face masks, gowns, gloves, and are beginning to provide that to our healthcare partners. And so I want to be cautious that if we continue to burn through it in ways that are not as organized as we want it to be through the organizational efforts of the public health department and related partners, I have to make sure that if you need hospital care, we're ready. So I pay attention to that every single day. But we've made hundreds of thousands in terms of individual supplies in any number of those categories, and they're beginning to come in. So that allows us to, again, engage. Second issue, well, what about swabs, right? Getting the personal sample, all right? And then if you're not going to do a one-person test tube effort, there are large machines that they call high-capacity machines. There's a number of them. New Mexico has 2 that we are working on making sure both of them can operate simultaneously. We're not quite there. Why aren't we there? Because the FDA has to approve, right, that those machines, those testing materials meet the COVID-19 requirements. They do. I'm dissatisfied with the federal government's response. We're really pushing them. And because I know that these issues can occur from prior experience in a pandemic and influenza, and having the state in a short supply once upon a time for flu vaccine, I typically ask our healthcare partners to proactively go after every aspect, and we did that. We have confirmation that we can increase capacity, waiting for materials, and I think that we can increase capacity at the lab. So let me tell you how many we can do today. We can run, in terms of a machine, right, with mass, we do it in mass quantities, not one person, test tube at a time. We can do 700 a day. We have the potential, as we get equipment, to do much better than that. The White House, I am confident, is clear that I don't want any interruptions in our supply chain, and I'm going to keep making sure that they stay clear in that context, and we're feeling optimistic about being able to do that. Testing sites. So I'm going to make sure I have this right. We have 9? 6. Come on up, Secretary. I want to make sure. Let's give them the facts. These get changed every day. This number I absolutely know I have right. We're going to stand up 5 more. One of those will be in Las Cruces. And for every New Mexican, it's a thank you. It's going to sound like it isn't, but it's a thank you, who are challenging us that you're not getting enough information from other sites in the state. We want as much information as we can get. If I have a positive case, we want to know about it immediately, and we want to deploy our public health services to do the surveillance, right, and check all of those contacts. So this is not an issue about picking a metropolitan area over another. There was never an instance where a hospital or a lab, they screen for all kinds of viruses. This virus is included. That you don't have the capacity to collect large quantities of data and samples and then run those tests in large quantities. That's the disconnect between what's going on. So let's do it again. We can test you anywhere. What are we doing to build capacity? I gave you those techniques, and then making sure people can drive through. I want to do one more thing related to this question. And I know it's a lot, but I want New Mexicans to understand. I'm going to make sure that as Secretary Kunkel tells you about the sites, so that you get the facts about those. I also wanted to talk to you about who should be going to these sites to get a test. We do not want walking well, and I know people are nervous. I know you are. It's hay fever season. 90% of New Mexicans who are being attacked, myself included, by juniper, in this environment, that feels, right, scary, and it's intimidating. And you have an obligation to sort of self-review those symptoms, or the same kind of symptoms. So I'm going to make sure you're going to hear about the sites we have up, you're going to hear more about where we're going, and you're going to hear about what you should do before you go to one of those testing sites. All right, that's critical. Secretary.
Thank you, Governor. We have 6 sites that are operating right now around the state: Presbyterian Downtown, Presbyterian Espanola, Christus St. Vincent, Holy Cross Hospital, and San Juan Regional Medical Center and Gallup Indian Medical Center have been operating and are still operating. We're setting up sites through the Department of Health at 5 additional areas, and on the advice of the epidemiologists, Roswell, Las Vegas, potentially Taos, Cruces, and we're working with the city of Albuquerque today to set up a site at the West Side Shelter.
Thank you, Secretary.
Only people who are symptomatic should go. I apologize, Governor. Only people who are symptomatic should go to these sites. There is intense screening. Yesterday we worked with all of the medical centers to standardize our screening process, to stress how important it is to make this available to people who are sick and to preserve our resources.
All right, so let me go through that screening process, and I'm happy to be not corrected, but make sure that the focus of the information that I provide, I do need to be corrected on occasion. This is changing literally every few minutes, and it should. We protect people by being dynamic. This is a state that takes pride in being dynamic and responsive and proactive and effective and firm, but it changes rapidly. So if you have COVID-19 symptoms, fever, dry cough, I forgot the third one. Shortness of breath, the one that's really, and that's an issue we want to address by any New Mexican that has shortness of breath. Call 911, right? Make sure that you do what you ought to be doing. Shortness of breath, dry cough, fever. What's the next group that ought to think about getting in the queue, going through these drive-by, drive-through sites, off-location sites? Have you come into contact with someone you believe to be COVID-19 positive? That's the next group. Is there a group, the next group has some of these symptoms, but not all, and also reason to believe that you've traveled. So you may not know of a COVID-19 positive affirmation, but you've been in high-risk areas around the country or around the world. These are individuals that we need information about, and we want to, our goal here is to show you that you're a negative. But for positive cases, for each positive case, it's roughly 34 people that you've been in contact with. That's the average. So it's incredible work for us, and we should do it, and we're capable of doing it, to do the investigations in that ratio to prevent spread. And what are we telling people? If you do not need hospital or medical treatment, where do you go? Go home. self-isolate at home. It's the best method to control the spread of this virus. Next question.
Governor,
I'm going to go back to you. I'm so sorry because I want to make sure that we get as many questions as possible, and I take too long. It's a lot of information, but I will come back to you, and if somehow we don't, we will stay socially distanced to try to make sure that we answer all questions. Yes, sir. And then we'll go over here.
Can you talk about how long the restrictions will stay in place? Use the mic. Oh, you are. Sorry. Can you talk about how long the restrictions will stay in place?
I'm so happy they did that to you, Patrick. This is my life all day, where someone explains to me that I'm not managing how I use the microphones. So we do. Why are we doing this? We want New Mexicans to be prepared and informed. Patrick, this order goes through March 10th. I said March. April 10th, thank you. April 10th. We're sort of framing things in that initial 3-week response, and related to that, we want to be consistent so people have been under a prior order or under the same time frame. Something that I want New Mexicans to prepare for. We do this so that when we execute the order the next day, people have time to think about it, get it done. It's hard to shift a business design. That is not easy work, and it impacts thousands of workers. But we're prepared to extend any of our emergency orders for as long as it takes to keep New Mexico safe and to make sure that we don't see unmanageable spikes and reliance on our healthcare system. That's the goal here. Okay. Oh, I'm going to do you, and I'll go in the very back. Okay. Yes, you.
Is this on? Okay. So for our Spanish-speaking audience, we've been getting the same 2 questions over and over. The first one is, when going to get tested, some are afraid. And the second question is, is there a number to call where somebody speaks Spanish? Because many are saying that they're not getting any help in Spanish.
All right, so let's do your second question first, which is, are we prepared as a state to provide in not just Spanish, but potentially multiple languages so there's no barrier? We are working diligently to do a better job. Absolutely never considered that we should not have Spanish speakers answering the phones, but as we've got nurse advice lines, right, and we're doing telehealth, and we're navigating this, and there are challenges, and we want people to tell us, so you thank the folks who are asking you questions, because it allows me to shift a focus to get it addressed. So the answer is yes. We have Spanish speakers. We're working on translating all of the information that we're making available in any number of Asian language and related, working with our tribal partners, tribal languages, so that we are doing our very best to make sure there's no language barrier to these issues. We do have challenges, we're aware. People should keep telling us. We want to know that when we succeed, and there's no barrier to you getting information. We've got Spanish speakers at every line, Spanish speakers at our nurse advice lines, Spanish speakers with our partners. I'm sure it's insufficient, and I'm going to take that as constructive criticism to do more. Second issue, for individuals who reside in our state who are undocumented, do not be afraid of the state of New Mexico. Do not be afraid of a local body of government. This is a government that is working hard to protect all people in the state of New Mexico. The healthier you are, the safer the whole state is. We do not share this information with partners who are not looking at public health issues. This is not being utilized in any immigration aspect whatsoever. And that fear is real and palpable, and as your viewers and listeners might know, that it is an issue from everything from gathering census data to public safety to emergency responders. I need everyone to feel like this is a state that's going to keep the whole state safe by getting as much information. If you're sick, you must come. You must call us if you have these symptoms. Shortness of breath, fever, dry cough, so that we can get you tested. Do not be afraid to call us. This is not about immigration or any enforcement. This is about public health and safety for everyone. Okay.
Yeah, given the developments today and kind of some of the orders you mentioned, I'm wondering if parents should be preparing for the possibility of kids not going back to school for the rest of this year. And secondly, some of these orders seem like they're kind of approaching a kind of a shelter-in-place order, and I'm wondering if that's something you're considering, depending on how things go over the coming days.
Right. So I am considering everything. The more proactive you are, the safer we are. I try to make these decisions in a way that helps people manage these incredible disruptions, that supports businesses who are asking us, and we've got a number of programs available. They're largely low-interest loans. New Mexico was one of the first states to get a confirmation that we can access the Small Business Administration's $50 billion that's available. But if you're trying to make payroll today, there are lots of businesses that are worried about having any loans at any interest rate are problematic. So we're reaching out to all of those. Now let's be specific about the question they asked. These are not orders to shelter in place. So they're not what you're hearing about for the debate in New York, and they're not what you're hearing about in San Francisco and nearby counties. If these orders are insufficient to keep social distancing from occurring, then we have to think about the next orders, including where are these cases coming from? Travel. I plan immediately after this press conference to write to the mayors, Santa Fe and Albuquerque, who've already been in touch with us. So we have incredible partners. We're in touch all the time, including the congressional delegation. So when people ask me, they are incredibly engaged and actually are helping remove these federal barriers for us to protect New Mexicans. Everyone's doing their part. But I want those mayors to immediately write to the FAA, and I want to know what the options are to limit commercial travel. And as a result, that's the same message we gave 3 weeks ago. We don't want panic. New Mexicans are in a number of places that are necessary work-related. Some might have had a family gathering like a wedding. Some might be on vacation. I need these New Mexicans to take seriously the precautions that this state is undertaking. And they need to think about finishing up that work, that vacation, that family event, and come home. Because we think that that is an effective way to limit incoming spread of the virus. And I want to repeat something. Are commercial flights still coming to New Mexico? Yes. Does the governor have unilateral authority to do anything about that? No. Should we be cooperatively working so that we can give advance notice to travelers and families with the FAA? And should I be looking at ways to restrict introduction of the virus and spread? Yes, which gets really to your question. Would I undertake any number of further restrictive policies to keep us safe? Yes, I would. We are not there, mostly because people have been cooperative. Families who are concerned about schools should undertake the kind of discussion you have in your family, that it is possible that those get extended as well. I promised every New Mexican, every school teacher, every child, every business, that as this changes daily, it's going to be that factual information that we utilize to make proactive decisions. Right? If we wait too long, then they're not proactive. That's not to say that if we have something else occur, we'll react immediately and just get it done. But I'm working very hard so that New Mexico stays ahead of the curve. And in many ways, and I'm going to do it, just like I did in the last press conference. I'm a bit reluctant, but I'm going to do it anyway. This is not a competition, right? With any other state, we should not be competing for supplies. The federal government should not say that states and governors are on their own. We should not have, that just creates worldwide panic. The whole nation is under an emergency declaration with untold, unheard of congressional action related to responding to the president's $1 trillion economic package. This is serious. It's real. There's a lot of work going on. But I do want New Mexicans to know this. Not every state has thought about being proactive in a way because it's painful, because people's lives are disrupted, businesses are lost and reduced. We've been so proactive that even with some of the issues related to gathering samples, testing patients and individuals, and then running them through so that you know what the results are, we are ahead of even many countries in terms of that effort. It's not enough. It's not a competition. The reason I want people to know that is I want them to feel confident that we undertake every opportunity, every potential, and we are continually engaged in capacity building. And I am a fierce advocate for the state of New Mexico, and I'm going after every single thing that we're going to need in the future. And I have every expectation that to the highest degree possible, we will get what we need to keep New Mexicans safe. Here.
Is this on? Okay. What is the Corrections Department doing to prevent an outbreak of COVID-19 in the prisons? And if there is an outbreak, what's a contingency plan? And would solitary confinement be considered for everyone?
So I'm going to do the same thing, last first. We have not considered solitary confinement for any number of reasons as the appropriate response to mitigate in the context that people think about it in corrections. Punitive, high risk. However, in any area where you have lots of people, right, there's going to have to be contingency plans, and we are doing that right now, making sure that we can get folks more sheltered in place, 6 feet apart to the highest degree that we can. Well before these public health orders, we already stopped visitation into our correction systems and have worked with all local bodies of government to do the very same in jails. What does that look like? That means we are increasing, right, free calls. Families are encouraged to call. Lawyers are encouraged to call. We don't want people doing in-person visits, either for legal work or visitation. So they have stood up more phones, more phone lines, more opportunities for families to see their family members, but we are mitigating contact. We did that early because it's a high-risk area for any state. It's a high-risk area for our state. Same issue. If there's any strategy that prevents spread, we will do whatever it takes to limit spread in every facility and every context. We also were early in limiting and restricting any visitation to long-term care facilities. So unless your loved one is in active dying hospice, where there's an acute issue that requires a family member, you cannot go. So I have a mom. I did not go. I will not go. I call. And they have one phone line. And sometimes my calls don't get through, and I just have to keep calling. It's painful. But corrections is a high-risk area. Thank you for asking the question. There's basically no visitation. Next question, over here.
As far as the curve of where we are we on that curve as far as infection goes?
So I'm going to go to Dr. Scrace, but I am going to do two things as you make your way here. We can talk about that. So far, if you look at our transmission rate I gave you with the sample, 1,720 tests to date, 28 positive confirmations. That's a 1.6 transmission rate. That puts us in pretty darn good shape. No disease is the best shape, right? That's the goal. We knew we weren't going to be able to do that with travelers, so now it's mitigating. Also making sure that we do everything early so that our non-high-risk groups are socially and self-isolating so that they don't spread. So in that regard, so far the data we have is good. Now, let me give you a caveat. If too many people without symptoms are in this collection sample, then that could be a different outcome. The more information we have, the more people who have symptoms get tested, then the better we can tell you about that curve. Today, we're below it. It's also early, which Dr. Grace will tell you, that when you start to see the kind of serious impact if you don't do these mitigation measures is 3 to 4 weeks from now. Right? So we won't know until then, but we can tell you unequivocally that what we're doing is exactly what you should do to be below the curve. Doctor.
Thank you, Governor. If you look at curves from around the world in countries that have had significant outbreaks, those peaks of those curves are tens of thousands of people. We're reporting today less than 30. And so we're still quite a ways out to the left of that curve. And of course, we're not shooting for this curve. We're counting on social isolation to give us actually this curve. And so we're still early. That gives our entire delivery system, healthcare system time to prepare, gear up. And if Dr. Smelser wants to add anything to that, you're welcome to do so. Thank you.
All right, we're going to do 3 more questions. I'm going to make you hang in there in case somebody hasn't asked it. You've asked a question, very back. And these bright lights, I can barely see you, so.
Maybe you made this clear already, but are any of the infections inside assisted living facilities? And the next question is just, you've complimented people in the state on abiding by some of the recommendations, but how much transparency do you really have into people who are flying in and out? You're telling people to come home. Have those people been exposed? Should they come home? Can you unpack that a little?
You guys are asking questions in a way that makes more sense for me to do the last one first, or maybe that's just what I remember. So that debate is tough. If you've got someone who's exposed, stay where you are, all right? Then you know unequivocally, or if you've got COVID-19. But look, they're gonna make their way here. We want to know who you are, and we want to make sure that we have every precautionary measure. So if you've been exposed, or you have tested positive in another state for COVID-19, absolutely do not get on a plane or a train or a bus. Let me repeat that. If you are a New Mexican and you are somewhere else in the world or somewhere else in the United States and you believe that you have been exposed, you're exhibiting symptoms, you have tested positive for COVID-19, that state should not be allowing you to just move unilaterally through their state or anywhere else. If you're not in that category, come home. What are we doing when you get here? We want to know about you. Call the Department of Health immediately. We've told every traveler, every work-related, every healthcare-related traveler, you must self-isolate for 12 to 14 days. We've had that in place forever, so that's your question, well, for a month. Your question is, are they adhering? I'm going to guess we don't have 100% compliance. Part of why I ask you to ask these questions, not this specific question, but to ask us questions, and to work to both hold your state accountable by these press conferences, but allow us to provide this information to the general public is they need to comply. I need you to think about this, and I've done it to very many businesses, and I've talked this directly to our tribal partners. One elder in one small pueblo that tests positive, gets COVID-19, has the potential, right? One person spreads to 3, 2.5 people in a few days. In less than a month, it's hundreds of people, like 400. 1 to just under 3 in a matter of days. In a matter of a month, hundreds. That wipes out Nambe, Taos. People need to think about what they're doing to their neighbors and their families and to other travelers in the states. So I want you to let us know when you get here. When you fly in to the airports now, you are met by giant yellow public health billboards. We ask you with social distancing in mind, with people, with personal protective equipment, to take information with these phone numbers and to immediately contact us. So we did that some time ago. I don't think it's enough, which is why I'm writing a letter to the mayors who are responsible in terms of at least leasing the property for our airports and to start working with the FAA, because to your point, how would I enforce that productively? So let's hope that New Mexicans will do best practices, but that's where our highest risk is, are people traveling in and out of the state. No question. You asked a question. Anybody who hasn't asked a question that I didn't get to? All right, because you've been really patient, and so you've been right there, let's go.
One more time, if we can, for the people
Yep.
who are just tuning in because we're taking this live. Can you go over the closures and
Yes.
when they take effect?
Yes.
Thank you, Governor.
Thank you, and thanks for your patience. All right, we are announcing today. They are effective tomorrow. They will go through April 10th. And we are immediately, right, reducing gatherings to 10. We are closing eateries, breweries, restaurants, and I want to be careful about that, and bars to dine out only. So we are not ordering the closure of those establishments, but you may not participate there. All right, so if you're a restaurant or you're a bar that serves food, you cannot do that as of tomorrow. Spas, gyms, movie theaters, shopping centers must also adhere to this public health order and must immediately cease their operations unless they can do something at that time. We're trying to create that flexibility. It's really intended for workers. We are encouraging workers and businesses to think again about how they can implement this 10-person work environment to the highest degree. There are some essential services, banking as an example, where that may not be possible, but we are encouraging it in the context of this order. We are also mandating that over-the-counter medical and hygiene supplies will be limited so that we don't end up in a situation where people don't have access to them. And I'm going to look really quick to make sure. I already talked about casinos and racing facilities. Here's one that I did not mention in the second time. Hotels, motels, and lodging businesses can only go to 50% of capacity, effective tomorrow through April 10th. Last one.
You mentioned limiting the amount people can buy. Can you talk a little bit about what that looks like to, avoid hoarding materials? Is somebody at the store going to check how many you have, or what does that look like?
It's 3 of those items per individual. Good question. And again, I want to do this. I am sure that there are many New Mexicans who are going to feel like this is such an infringement on their individual rights to purchase what they want to purchase. But if I have a family with children who can't get formula, and we have families and seniors and disabled adults all over the state who can't access toilet tissue, and you need over-the-counter pain medication, allergy medication, we need there to be enough. There's enough. Here's my message. We're not rationing. We're not withholding. We're leveraging. Give these grocery stores and convenience stores, and again, thank you to the men and women who are working overtime to make sure that you have access to those products and food. There's nothing that they are saying to me, nothing that I've heard in the country, nothing that we've heard anywhere around the world that the supply chain is problematic. It's keeping the stocking, right? We need to close long enough to stock, and that people are taking everything off the shelves. 3 per individual. All right, I want to end with this. Your government is not panicked. Your governor is not panicked. Your state and governor are prepared to make every difficult decision to continue to keep us safe. Every potential decision that does that is on the table. Going forward, we'll do the exact same thing. We will update our website. We will make sure that people are getting information as quickly as we can get it out. We're going to rely on the media, who in New Mexico, quite frankly, have done an outstanding job. We need you. If you don't do what you're doing right now, and there's some risk for you to be here, we've asked you to stay away, and you're doing it, and we're webcasting this because we're taking seriously the social distancing issue ourselves. We're going to keep providing that information so that you get it ahead of when we execute it. I also want New Mexicans to know we're on the phones with businesses and owners and employees all the time. We don't just, it's not a complete shock to the system, right? We're working with them. That minimizes that we're not in an enforcement environment. We're in an altogether New Mexico environment. This has drastic economic consequences to the state. We're trying to get as much as we can into the households of our vulnerable families. You're going to have to help us. We want to make sure, right, that you have the information. So let's do the health hotline before we close. This is only for health-related questions, including I'm exhibiting symptoms, I need to talk to a nurse or a provider, I need a test. 1-855-600-3453. 1-855-600-3453. Where's my other number? There it is. Right, same chart. The other one's for everything else. Meals, transportation, products, questions about childcare and school, everything, anything, businesses who were looking for support and advice and loan applications. Any of those calls should go to 1-833-551-0518. 1-833-551-0518. And remember to go to CV, coronavirus, cv.newmexicohealth.org for regular updates about what your state knows. Providing that, we want to be completely transparent and what information you might need to navigate this information. So I want to end, really, I promise now, with two quick things. We are not panicked. We are working to be prepared. We think this is hard. We think it has real consequences on the disruption of daily lives of every New Mexican and our businesses. And we do not take lightly our responsibility to keep you safe and to keep our healthcare workers, our grocery store workers, our incredible child care workers, and many others, and our other first responders, police and fire. Thank you to them and all the workers who are showing up every day to make sure that hundreds of thousands, as an example, of meals are being delivered to needy children and families. I thank you. I encourage people to be kind, to be informed, to be fair, to be just the kind of state and people we've always been known for. And 3, we are prepared to do whatever it takes and invite constructive criticism, which we are getting, about language barriers, wait times on the phones, and we need that, and issues about making sure that testing and related services that help us prevent spread are as readily available as we can make them. It's helpful to us. You should expect us to work to fix every system that makes us safe. Thank you.